Good morning, students.
Good morning, sir.
Today we are going to discuss the BLS. BLS means Basic Life Support. Okay, for which type of patient we will give the Basic Life Support or CPR. CPR also we can call this procedure. Or main name of this procedure is CPR. CPR means cardiopulmonary resuscitation. To whom to which type of patient we will give the CPR? Person who is unable, whose heart is unable to work, or second respiratory system means patient whose respiratory system is not working. ठीक है. For example, suppose ये unconscious patient, suddenly you see that one person is lying unconsciously. So what is the first step? First step is the immediately call the patient by name along with tactile stimulation. ठीक है. Suppose here Mr. Ram. Mr. Ram, are you okay? Mr. Ram, are you okay? Along with tactile stimulation, you have to give the 3 to 4 times tactile stimulation. If patient is not responding, immediately you have to lose the clothes of the patient and provide the supine position on the flat surface. Like here and that below the head, we have to remove to extend the airway. And immediately you have to call the someone. Somebody help me, somebody help me, somebody help me. And you have to check the carotid pulse of the patient for 5 to 10 seconds. Immediately you have to check the carotid pulse for 5 to 10 seconds. Suppose patient pulse is absent, slow or irregular. Immediately we have to start the chest compression for that. Okay? So how you have to provide? First you have to find out the where you have to place the heel of the hand. So for placement of heel of the hand, you have to find out the G-point process. How you will identify? You have to put your both hand below the ribs where both ribs are joining. That is the G-point process. Put 2 fingers at the G-point process and just above of the 2 fingers you have to place the heel of the hand. Heel of the hand is this part. Okay. This is the 2 finger management. Then you have to midline to left side and prepare this time. Keep your hand chest and patient chest equally to keep your dominant hand straight, and immediately you have to provide 30 chest compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After that, you have to check the carotid pulse of the patient. You will find definitely carotid pulse now. When heart is starting to work, then we have to evaluate the here in CPR. We have to proceed from CAB. C stands for circulation, A for airway, and B for breathing. Okay, to evaluate the breathing immediately, you have to provide the head tilt and chin lift position of the patient. How you will provide? Here on forehead, keep your one undominant hand and make C shape, and another hand, 2 finger and thumb, you have to lift the chin, and you have to take breath in and give 2 rest of breath. Like this. Here, what is that? When look, listen, feel. look में when you are giving the positive pressure ventilation or breathing to the patient, chest of the patient will rise. That you will not observe. But when you will stop the breathing, immediately expiration will occur, and that time you have to observe the, you look the fall of the chest. That is the meaning of look. Listen, you have to keep your ear near to the nose and mouth like this, and you have to listen the abnormal breath sound. If any is there, then you have to further investigate and feel here whatever your air is expired by the patient, that air you have to feel on the cheeks. Okay, that is it. You have to give the to rescue breath. If chest fall or rise नहीं हो रहा है, means that will indicate there is any obstruction in the airway. For removing of the airway obstruction, we have to follow the one procedure that we can say Hamlet maneuver procedure. Now I am going to tell how you have to give the Hamlet maneuver procedure to the patient. So for example, if patient is infant or toddler, you have to give the Hamlet maneuver procedure keeping the patient on your hand. Okay, so how you will keep the, first you have to take the child with neck support because child is unconscious properly, and provide prone position on your hand like this, and cross the both extremities your hand, and head is lower than the body like this position. Here you have to keep in the mind that you should not keep your hand like this, otherwise already patient is not breathing and you will further interfere the breathing pattern. So you have to provide the space between this. Okay, like this you have to provide the space so that patient can breathe normally. Okay, and keeping this you have to provide 4 to 5 back balloons like this. So whatever foreign body is there in the mouth or respiratory tract, it will come in the mouth. Immediately you have to provide the supine position, open the mouth. Here one important precaution, do not put any object or finger to sweep out the foreign body based on suspect. When you will definitely confirm that foreign body is there in mouth, then only you can put your little finger in the mouth and sweep out the foreign body out. Okay. If foreign body will not come in the mouth, then again you have to start the same procedure. Keep the child on your hand, same procedure. Again you have to back below 4 to 5. Clear? Again supine position. So this is the for the next, and second is the for the adult persons. Here for adult person we can do in the standing position this procedure, but here two important things we have to keep in mind. First, rescuer height is more than the patient. Second, rescuer will be capable to lift the patient. So criteria if you will fulfill, then we can proceed for the standing position. So here for standing position, how you have to make the twist, you have to keep your hand and joint like this, and your thumb projection, thumb bone will be projected, and that you have to keep on the G-point process. Okay. So now I am going to demo how you have to keep. You have to stand back of the patient, and below arm you have to take your hand and you have to find out the G-point process. Okay, here ribs are joining, so here we have to make the paste. Okay, and when you are giving that patient is unconscious, so you have to provide the support with your shoulder, and when you are lifting the patient, you have to keep the forward the head. Okay, like this, and we have to lift the patient like this 3 to 4 times, and immediately after lifting you have to provide the supine position on the bed and open the mouth, and if there is foreign body then we have to sweep out. Clear? If foreign body is not removing, then again we have to do the same procedure. For example, we have removed the foreign body. Now this is the third way of providing Heimlich maneuver procedure. Here, for this condition, if rescuer height is less than the patient. Second, if rescuer is unable to lift the patient, means he has not having sufficient muscle and to lift the patient to stand, then we can give this weight procedure. So here we have to provide the prone position to the patient by turning the head in one side, either left side or right side. Here, and with the like this way we have to turn the head one side, otherwise you will keep straight, then further it will obstruct the airway. Okay, so you have to either left side or right side, you have to turn the head, and with the help of any object you can keep the lower extremity and lower trunk upper than the head. So here I am using the pillow to make the body high like this. So here that head is lower than the lower extremity. Same way we have to give the 4 to 5 back below like this. Okay, do not give this type. So whatever foreign body is there in the respiratory tract, it will come out position on flat surface and open the mouth and sweep out the foreign body. After clearing of airway, then now airway is clear, we have to start the positive pressure ventilation along with the chest compression. Here 30 chest compression and 2 positive pressure ventilation or rescue breath we have to provide. So here 2 rescuer we need, one rescuer for the chest compression and another rescuer for the positive pressure ventilation. And when we are providing the CPR, we have to count loudly. So it should be audible to the second rescuer. Okay, when I will count like 28, then second rescuer has to start the taking deep inhale. When I will say 29, he is ready to pinch the nose, and immediately when I will say 30, immediately second rescuer will deliver the 2 rescue breath, and this cycle we have to follow. Clear? So now madam is the second rescuer and I am first rescuer. So how we have to provide? Same way we have to place the one finger on the G-point process, major 2 finger, or another way we can draw the imaginary line between the nipple and just below of imaginary line put 2 finger and place your heel of the hand for the chest compression. In both way same place will come. Okay. So here I am placing the hand Now we have to start the chest compression. Okay, first rescuer has to take his or her position like this way. 1 minute to stop. We are going to start the CPR. Okay, so I am first rescuer, so I will give the chest compression. Here I have to keep the heel of the hand middle to left side. Your dominant hand. If left is, then left can be utilized. Right hand, then right hand can be dominant hand. This way you have to make the twist. Okay, here जो second rescuer has to make the head tilt chin lift position, and another rescuer will give the chest compression. So I am giving the chest compression like this, and we have to count loudly so that it should be audible to the second rescuer. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Cut paste कर देनी है. Now second to give the breath that she will demo. Now you have seen that how we have to do the chest compression and positive pressure ventilation. This 30:2 cycle we have to provide for the 1 minute. Means you have to try to complete 2 cycles in 1 minute, and after completing you have to evaluate the carotid pulse for circulation and check the respiration. When respiration you will find out when you will give the positive pressure ventilation by observing the chest movement. Okay. Suppose patient respiration is improving and circulation is not improving, then we can discontinue the positive pressure ventilation. We can continue the chest compression for 1 minute. And we have to try to complete the at least 100 chest compression per minute. Okay. And again we have to evaluate the carotid pulse, and till the patient is not recovering, तब तक हमें chest compression continue करते रहना है. Suppose patient circulation is improving but respiration is not improving, then we have to give the positive pressure ventilation by keeping 16 to 20 breaths per minute. If both are not improving, then first we have to give the for 1 minute 30:2 cycle, then second stroke will be the for 2 minutes, then simultaneously for 3 minutes, and every time we have to evaluate. Okay, and when up to when we have to continue this CPR when patient जो pulse or respiration is not improving, or either till the ambulance arriving. If ambulance arrives, then we can give the take the patient in the ambulance and connect with the ventilator. Okay. Some basic questions. Now we will discuss some queries or doubts regarding CPR. Okay. For example, if patient is having neck fracture, then we should not provide the head tilt chin lift position, because here when you will give the head tilt position, it will affect the neck bones, and that may protrude in the neck and will interfere or close the airway. So in this situation we have to provide the jaw thrust maneuver position. How we have to give the? You have to place your fingers below the chin and two thumb here. With the help of finger, try to lift the jaw, and with the help of thumb, you have to compress the chin. So it will ultimately open by keeping up jaw, that will open the airway, and same like head tilt chin lift position, it will support to open the airway. Clear? Second, mostly students are having doubt. For example, if patient is having ribs fracture, so whether we have to give the chest compression or not. Then also we have to give the chest compression. Some student or some rescuer will think that if I will give the further chest compression, it will further lead the fracture in the rib. So in that case, if you will not give the chest compression, that it will lead the death of the patient. If patient will survive, then ribs we can repair after surgically. So we have to give the chest compression even patient is having rib fracture. And third most important thing, like sometimes patient is semi-conscious and patient is vomiting. So if patient is vomiting, then also we have to give the positive pressure ventilation or not. We have to give. Some rescuer or some student will think that patient is vomiting, so how I will give the breathing. So while episode of vomiting means content is coming out from the mouth, you have to hold immediately. While content coming from the mouth is stopped, immediately you have to wipe the mouth with your hand and give the positive pressure ventilation. If again patient will start vomit, then you can discontinue. But here only we have to discontinue for the episode of vomiting. Okay. While we are giving the respiration, you can utilize any cloth like your handkerchief, towel, or any cloth you are wearing to keep on the mouth to avoid the communicable infection, because you do not know about the patient. So patient may have the respiratory or communicable disease. To avoid the direct contact with the microorganism, you can utilize the towel or handkerchief or any cloth which is clean on the patient mouth. For infant and toddler, you know the infant who is infant, child whose age is 0 to 1 year, and toddler 1 to 3 years. Okay, so for this age patient, we have to give the mouth to nose and mouth. Mouth to nose and mouth means suppose this is the child, so when you are giving the positive pressure ventilation, you have to keep the patient nose and mouth in your mouth, and then you have to give the positive pressure ventilation. For above 3 years of age, we have to give the mouth to mouth respiration. Some student or some rescuer may think or may have doubt like when to discontinue. When he or she will feel tiredness, then we can discontinue. So this is not criteria for discontinuing of CPR for tiredness. When rescuer is completely unable to continue the chest compression, then only, like he or she will not be able to sit, then we can discontinue. If you have the sitting capacity, then also you have to continue the chest compression. Clear? For children, like adults, I told you already, like we have to give the by hand two-hand method chest compression. For infant or toddler, we have to go for either two-thumb method or two-finger method. Okay, like this same way we have to place the one finger in the midline and another should be in left side, or this way we can give the chest compression. Okay, either two-thumb method like same, one thumb you can place on left side, another should be in the midline, and you can give the chest compression. And another third method by crossing the thumb like this. One thumb should be in left to midline and another should be in the above of the thumb. This cross thumb method is very helpful because it will provide the comfort and strength to compress the chest. Okay. And another one of the most important benefit of two-thumb method, also two-finger method, is that based on one rescuer here can be able to give the chest compression and respiration like this, and we can give the breathing also.